WEGOVY heart condition. Novo Nordisk WEGOVY demonstrates greater weight loss in women with heart condition. We're going to talk all about it in today's episode. Hi friends, I'm Elizabeth, Countess of Shopping. I've been on GLP-1 medication for the last 17 months and I'm on my vacation edition here. Normally we're in the studio and today we're going to be talking about a new study that just came out on Novo Nordisk, and we can relate this back. While I have been on Mounjaro, and because of the Mounjaro shortage, Zepbound because of the Zepbound shortage, on compound tirzepatide, we can relate back to GLP-1 medications. We can take common threads, and while WEGOVY is a semaglutide, is different than Zepbound for chronic obesity management, which is tirzepatide. Somewhat similar information that may be helpful for you if you have heart conditions, family heart conditions, about GLP-1 medication with this new study that comes out. As always, I do require of myself to be factually accurate, so I will cite my source or sources down in the description link below. Just click that ... more button if you want to cross-reference, because as always, I want to make sure the information I'm giving is factually accurate and up to date. I found this study fascinating. There was a new study that came out in recent analysis of a study data involving 1,145 patients centered around a condition known as heart failure with preserved ejection fraction. That's HF, lowercase p, EF. The data from these studies was shared with the American Diabetes Association's scientific meeting in Orlando, Florida. Reuters reported on Monday. And as of release of this article, it was June 24th, 2024, to give some context of what they're talking about. While the drug led to similar, WEGOVY is what they're talking about, improvements in that HF, lowercase p, capital EF symptoms, which stands for, it's basically about heart failure with preserved ejection fraction. While the study led to similar improvements of the symptoms in both genders, women lost on average 9.6% of their weight compared to men who lost 7.2%. How crazy is that, by the way? I don't know about you, but before reading this, I for sure would have said that men would have lost more weight than women on semaglutide or on WEGOVY weight loss. And by the way, like Zepbound weight loss, I'm lumping all GLP-1s in together, tirzepatide weight loss. I would have put my money on men losing more weight than women, but this is not what the study is showing from that 1,145 patient pool size. The trials were not designed to evaluate the treatment effects of WEGOVY, chemically known as semaglutide, by biological sex. However, the greater weight loss in women did not result in significantly better improvements in heart failure symptoms. I found that part fascinating. So the first part I found fascinating was that women lost more weight than men. And then the second part of that is women did not result in significantly better improvements of heart failure symptoms. So that is also fascinating to me too. Further research is needed to identify the reasons for this discrepancy, the researchers said, of why women's did not result in significantly better symptoms in heart failure symptoms. The HF, lowercase p, f, EF, accounts for about half of heart failure cases, mostly affecting overweight people, especially known among women, prior studies have shown. Why does this matter? Well, earlier in March 2024, the Centers for Medicare and Medicaid Services, CMS, began reviewing inclusion of WEGOVY under its coverage for heart disease patients with obesity. This came after the FDA's action to expand the use of WEGOVY to reduce the risk of cardiovascular death, heart failure, stroke in adults, and cardiovascular disease, either of obesity, overweight, which we know as of right now, the way U.S. laws are for Medicare and Medicaid, you cannot get for chronic obesity management treatment, GLP-1s covered. And so having this kind of backdoor around it's the FDA approval for heart disease of WEGOVY is going to be, which is why they're talking about Medicare and Medicaid Service, CMS, reviewing the inclusion under those coverage of it. Let's continue. Okay, in April, Germany's competition authority, and I'm going to butcher the saying of that, cleared the planned acquisition of Cardio Pharmaceuticals GmbH by Novo Nordisk. Cardio is a biotech firm or biotech company focusing on heart diseases, especially in heart failure. Anyone have heart disease in their family? I mean, I do. I feel like we all do, right? It's like the silent deadly killer for most people is heart disease. This is fascinating to me. Fascinating to me. And so that was one of the pieces of the stories. I thought that was written really well. Let me give you the second piece in here too that broke down about that there's this the heart disease that we're specifically talking about, the HFpEF program. It has from patients with obesity-related heart failure, preserved ejection fraction, a condition where the left ventricle does not control properly, resulting in lower blood circulation in the body. The study was primarily conducted to determine the effects of the 2.4 milligram dose of WEGOVY and semaglutides weekly on health participants. Can you imagine, by the way, being in that study? These studies fascinate me. And I know many of our counts and countesses in my free encouragement group tell me that they're on the clinical trials for a bunch of different stuff. So I'm always fascinated hearing about these studies. So according to the finding, women lost on average 12.6% of their weight after the dosage for 52 weeks, whereas men lost about 10.2% of their weight after the same duration. By the way, I'm going to keep going on the article, the second article on this. I would love to know your insight in the comments down below of why you also think that is. I have some of my thoughts, but I want to hear yours. Tell me in the comments below if you have hypotheses as to why for women. I'm curious. Okay. The article goes on to talk about the senior author of this, the cardiologist at St. Luke's Mid-Heart Institute in Kansas City, Missouri, Dr. Kazi Borode, commented that it sheds light on these differences and the consistent benefits of semaglutide for men and women, which is true. We know that, I mean, for me, I've lost 90 pounds on tirzepatide weight loss. It's been a miracle for me. And having done every single diet known to man, Atkins, Weight Watchers, you name it, the cabbage diet, Mediterranean diet, Nutrisystem, Jenny Craig, like you name it, I've been on it since I was like 8, 9, 10 years old, first diet. So seeing that these other GLP medications are helping these other comorbidities is huge. I talked in my previous video about non-alcoholic fatty liver disease, kidney disease, heart, sleep apnea. All of these studies are coming out, and that's what's fascinating to me. 17 months ago when I started GLP-1 medication, I mean, people poo-pooed me taking this medication, and I'm like, who's the last one laughing now of like all these other conditions it's helping? Like going from morbidly obese to this was on one of my recent travels. I mean, that's crazy to me. There's another picture. It's crazy. And the comorbidities that are getting included and that we're finding scientifically that are helping. But the interesting differences between men and women with these, it blows my mind. Like, it just blows my mind. I'm fascinated by this, of how much it really, really is changing lives. But also keeping in mind as we talk about these too, is the access to these medications, right? Like we already had mentioned about how on Medicare, you can't, because of that Medicare law, you can't get GLP-1 medications for chronic obesity management. Obesity treatments cannot be covered by Medicare based on the law right now as it stands. I know for a fact that Novo Nordisk and Eli Lilly are both lobbying to have that law changed as we learn more about GLP-1 medications. But it's interesting, these new studies coming out about how beneficial it is. I'm here on my vacation edition. I'm here, we're on vacation. And it's been amazing, my physical differences with being able to be more active and the food choices I've had. Being intentional about these permanent lifestyle changes as a result of these medications, I mean, that's going to continue to help too. I mean, prevent heart attacks and these other things as well, is because I'm moving more, because I'm physically able to move more. I was not physically able to move more when I was morbidly obese. And now being able to move around and to go swimming, I mean, I'm like a triathlete over here of swimming and walking and bike riding and all of these cool things as a result of GLP-1 medication. I was not able to do it prior to. And so I find these studies fascinating about the heart disease component of it and the differences betwixt men versus women on these too. To me, it just blows my mind. It blows my mind. So on today's episode, a couple of things You guys know I am obsessed with Bioptimizers with today's video is not sponsored by them. I'm just obsessed with it and I want to make sure you guys get it if you haven't. Is the 7 types of magnesium in one. I will link that down in the description link below. Has made a major difference for my weight loss. I started taking magnesium when I first started taking GLP-1 medication, but the one I took only had 1 type of magnesium in it. This has 7. Made a big difference on my sleep. How do I know it made a big difference on my sleep? My Oura Ring. I have actual scientific data from my body to tell me before and after. So I will link that down below. They've given us a discount code. And then Electrolytes has been instrumental with their electrolytes of magnesium, potassium, and sodium to help with my side effects, my GLP-1 side effects. But also I'm just sweating a bunch down here. As I'm working out a ton, the muscle recovery component, I used to have really bad leg cramps. And so this has been huge. And I bought LMNT because Olympic athletes take it. FBI snipers take it. So I was like, if it's good enough for them, it's good enough for me. I know my light's changing here at the beach. I'm trying to get back into the sunlight. I'm like, bring back the sun. So that's been one of my biggest things. And then also one of the other things I want to talk about too is the encouragement standpoint. And my free encouragement group, friends, if you are not in that group, you check yourself before you wreck yourself. The accountability that comes with other people being on these medications, thousands of people, the Countess of Shopping army strong of counts and countesses, encouraging and uplifting and educating. I do require that we're factually accurate there and of course here on YouTube too, but it's been really, really helpful for me. And so I want to make sure that if you need encouragement or if you have a new bestie who's starting GLP-1 medication, share with them this video and all of my free links. I've got a free meal plan listed down below, a ton of free resources. And the new one's coming out. I just haven't, it's dietitian created. I bought it. So I own the licensing rights to my 2nd meal plan that will be coming out very soon. It needs to go to the editor too. So sweet friends, our videos for today is going to be a female emoji. That means the emojis I do, A, it tells me that you've made it this far in the video and it helps me to get to know you better because I care. And then B, also with that, I will pray over you. If you don't believe in prayer, I'll uplift you in positive thought, but it's like my bat signal. It's my bat signal of getting to know you better too. And I want to know today what you're doing today to move you closer to your goals. Tell me in the comments as your accountability question. Sweet friends, I will link all of the resources I talked about in the description link below. Just click that ... more button. You may have to click that more button twice. YouTube's done some new things with the description of to pull it up. And I have a very lengthy free resources. And then of course my other shopping stuff too, if you're interested. But my sweet friends, be kind to yourself, be kind to others. I'm Countess of Shopping. Count my blessings because life is delicious. Have a great day, friends. I'll see you later. Bye.